Hello, this is Robert Whitaker with Epica Animal Health, back with the third case type in our 12 case types series for Epica's HDVI technology. Today we're going to be discussing cases that have to do with spines. So what we're going to see in the spine, we're going to identify all the anatomy in 3D and 2D. We're of course going to also discuss the differences with myelograms and IV contrast. When we use a myelogram, we are essentially injecting contrast into the spinal column in order to see any possible disc deviations in the spine. The contrast allows us to see a fresh disc displacement. However, with the HDVI CT, we can see disc displacements in mineralized disc material or extruded disc material that has mineralized. We can see that usually without myelograms. IV contrast can sometimes be used in spinal cases to, see the soft tissue around the spine, but normally it doesn't really help us that much to use IV contrast in the spine, but it does help us see other structures that are in the region of the spinal anatomy that are soft tissue a little better. We are going to be able to get really good answers for the pet owner. When we are imaging the spine in a lot of hospitals, it's usually because this animal that has come in lame, or it can't get up, or there's urinary or bowel incontinence. There's all kinds of different symptoms that would lead us to doing a scan of the spine. And what often happens is these conditions of the spine are underrepresented in radiographs, or we can't see them at all. Our first case today is a 7-year-old German Shepherd named Bo. He weighs 74 pounds. He came in with weakness in his hind end, ataxia. This has been going on about a year and getting worse. He has bowel incontinence. They went straight to the Vimago with this case. They did not take radiographs at this specific hospital. They use a Vimago HU, which is the second generation Vimago system. This was sent to Bob O'Brien, Dr. Bob O'Brien of Peregrine Radiology for review. His findings, they're going to be at the L7S1 juncture, where he sees and notes ventral spondylitis. He also notes mineralized disc material at several locations, L5, L6, L6, L7. Discospondylitis could be, that he speaks of in the L7S1 region, could be a bacterial or fungal infection. We can visualize right off the bat in this sagittal view in the top left, we can visualize what's going on with the extruded disc material. It's easily viewable as it is mineralized. We can also see when we thicken, this extruded disc material becomes more prevalent in the images. Bentley is a 4-year-old French bulldog who weighs 21 pounds. He's been experiencing neck pain for several months. Radiographs were taken, but were inconclusive. A spine scan was done by a Vimago HU, which was a second generation Vimago at this specific practice. The images were sent to Dr. Bob O'Brien at Peregrine Radiology. We have a problematic spine, basically cranial to caudal. The C-spine, C4 through 5, we're seeing moderate compression of the spinal cord here with a big glob of something that appears to be very mineralized, but it seems almost liquid because it's spherical. Very, very spherical structure. It's the C4, C5. We're also a little bit further down seeing what's considered a malformation, or along with some hemovertebra, which is, essentially hemovertebra is just a malformation. It's a congenital disease that some of these French bulldogs are born with. Spinal process fusion at T7 and 8. in the same area. T9 is about where your malformation is. There's no degradation there. It's just fusion. There's also a little further back when you get into the lumbar spine and further into the thoracic spine, T12 and T13. We've got mild compression there, along with a little bit of disc material. So how does Vimago, or Pico for that matter, pay for itself using spinal scans as a case type? How many are we going to see of these every month? Well, in a typical 2-doctor practice, you might see 3 or 4 a month, but we'll just say, for lack of arguments, every full-time DVM averages about 2 cases a month. Of course, there's some cases where you have none at all, and then there's other months where you have several. We're going to look at a $750 scan fee for a spine. That's about $1,500 a month per full-time DVM in revenue. Other benefits would include, we're going to see conditions that radiographs just won't see. And that's just a limitation of the technology of radiographs. Radiographs give us one view from one plane, and that's it. Whereas the HDVI-CT, we're getting 2D and 3D captured all in one study. We're going to be able to identify these problems in-house. That's a huge benefit, to see the problem in-house rather than referring that animal down the road to have an MRI, which is highly expensive, or to have a myelogram CT, which at a lot of specialty practices in urban areas is also very expensive. So we want to be able to identify the problem in-house. Now, we're going to also be able to expand our services that we're offering in-house in a practice that owns a Vimago. Those doctors or a doctor can, at this point, begin to offer decompression surgeries or surgeries for intervertebral disc disease, so to speak. Those surgeries can be learned. You can go to different schools around the country, labs that are held around the country every year to learn this surgical procedure and to learn other spine procedures as well. So you can actually, by adding this Vimago technology, have the ability to add more services, not just imaging services, but also add more surgical services to your practice. Don't forget to go to our website at epicaanimalhealth.com. Learn more about our warranty service and maintenance program that we call Epicare. If you are looking to purchase CT in the near future, you can download our CT Buyer's Guide and learn more about what it takes to add this technology to your practice, what to look for, what to watch out for, things that you consider maybe that you're not thinking about now. All is covered in your CT Buyer's Guide that you can download from our website. If you want to learn about CT from a very basic perspective, Dr. Bob O'Brien, our chief radiologist, teaches CT 101. It's also available at epicaanimalhealth.com. You just need to go there and register. If you want to watch other real cases by our HDVI CT machines, they are on YouTube. Scan this QR code and it will take you to my YouTube channel with a playlist of over 100 cases for you to see just like these. Thank you so much for joining us. Have a great day.